This is for my intro to HIPAS class. I am interviewing two people of related exercise science, just related field in the area, kind of getting an understanding of the experience and different things in the area, and that's basically why we're doing this. I have a couple questions. Basically start off with what degrees do you have? What credentials would you say that they actually are?
Well, I have a Bachelor of Exercise Science, and then I have also a physical therapist assistant degree.
Okay. How long did it take you to get those?
4 years for the Bachelor's of Exercise Science,
Okay.
and then I went back to ASU, and it only took me a year to get my PTA degree.
Did you have to apply for the PTA
Yes.
program? You did?
Yeah.
Okay. All right. Why would you say that you chose your profession?
Well, I went into exercise science just because I played sports in high school, and I wanted to stay along the lines of athletics, thinking that I would do maybe some personal training or something along the lines of staying in physical therapy. So that's why I chose the exercise science degree. But when I got out of my exercise science degree, it was, for me at that time, it was hard to find a job around here.
Okay.
So I worked in a physical therapy clinic, did mainly tech positions, did some cardiac rehab, which is another emphasis of the exercise science program. Did that for about 2 years, and then just decided to go back and get my PTA degree.
Okay. Where did you work whenever you did?
It was Doctor's Hospital, Network
Okay.
Clinic, for a company called Rehabilitation Incorporated, which I don't even think they're in business anymore. But
that was in the Powder Bluff area?
yes.
Okay.
Yeah.
Okay. In the Powder Bluff area, would you say that the job opportunities have increased or decreased? I know Powder Bluff is growing kind of out this way, actually. Would you say that it would be easier or harder to get a degree or to get a job with simply the exercise science, a major or bachelor?
I would say so, because I mean, just depending on what the person wanted to do with it. If you wanted to go into personal training, any type of situation like that, it's probably going to be a little bit more difficult for this area. I would say probably in an area where you would have more opportunities to get a job, Springfield, St. Louis, something like that, you'd have a better opportunity.
Okay. What would you say? I'm sorry. Would you say the exercise science degree would be a good base, a good starter for somebody that would want to go into PTA, PT, OT?
Sure. Yes. Yeah, I think
Okay.
so. Because you're already in a lot of the exercise science classes. Even like a biology degree goes right along with what you would have to apply for if you're wanting to be a PTA.
Okay.
So yeah.
For the Powder Bluff area, for someone just starting out, what would you say the base salary would be for simply getting the bachelor or the master degree in for the PTA, for the basically any job that you could get in this area? What would you say a starting salary would be?
I would say anywhere from 25 to 35,000, depending on what. If you worked in a private outpatient clinic like this, starting out would probably be around 25. If you want to go into a home health situation, you're probably going to be looking at more.
And what would be a home health situation? What would that be?
Where you go into someone's houses and you perform physical therapy.
Is that
as
big
an
enough?
assistant?
Okay, yeah.
PTs obviously going to get paid more. You have, I think, 4 different companies here, so it would probably be easier for a PTA to get a job there or at a nursing home than an privately owned outpatient clinic like this one. You're bigger. I'm trying to think of like the Park. Hospital-wise, you'd probably be able to get a job there because you have the hospital you're going to be working at, you have the outpatient you're going to work at, inpatient they're going to move you around more.
Okay.
So.
Okay. What advice would you give to anybody pursuing this profession?
Exercise science or?
Exercise science, master, bachelor, and simply exercise science.
Just have a goal of what you want to do with it. If you're wanting to open up your own clinic base and do exercise science as far as personal training, general conditioning, well-being. Just have a goal and start small. Start out with some clients, and just understand that you're going to have to get a base of clients that you want, and do well with those clients, and know what you're doing. Just get, I guess, more advertisement. Advertise yourself. You would have to do something like that. I know it didn't work for me because that's not what I wanted to do. I didn't want to open up my own clinic, my own personal training place.
Yeah.
So what I was wanting to do was cardiac rehab, but then situations changed. So I would just say prepare yourself now and try to get that foundation set and laid down wherever you're going to go.
I've got a couple of friends that are actually thinking of doing cardiac rehab. Is that big in this area, or?
The only cardiac rehab they have here is at the hospital. And I don't know when this was passed or when this happened, but you have to have a full-time RN employed, and I think it has to be hospital-based, so you have to be near a hospital now. So that's why, when I was at Doctor's Hospital, we didn't have a RN. We had to do it in the clinic downstairs, and so you had nurses around. But now I think you have to have a nurse RN on staff, or even a doctor. You have to have a doctor there also. So.
Okay. Well, that's all I have. I appreciate it.
You're welcome.
Eudaley. I am doing this for my Intro to HIPAS class for Arkansas State. Basically what it is, I am interviewing a couple people who have exercise science related degrees, kind of get a better understanding of the area, what I want to do exactly, and just kind of get a little better understanding of what is all going into what
major.
This is.
Yeah.
Yes, ma'am.
Yeah.
I'm going to start off by asking just a couple questions.
Okay.
No big deal anyway. Please state your name and what degrees or certifications that you have.
My name is Kim Steckenschneider, and I have a Bachelor's of Science in Exercise Science. I graduated from SEMO about 4 years ago, or Southeast Missouri State, I guess I should say. I have a personal training certificate from AFAA, and I have a health coaching certificate from ACE.
Thanks. Okay.
Yeah.
How long did it get you, or how long did it take you to get your exercise science degree?
Okay, now that's a long story. I started right out of high school. I went to St. Louis University, was in a science-based major, quit school, got married, had children. I worked in ophthalmology for 22 years, so in the medical field
And what
for
is
a
that?
while. In ophthalmology, eyes.
Okay.
Eyes.
All
So
right.
worked in eyes, like I said, for about 20 years. Decided I wanted to go back to get my major. Or finish my degree. Originally I was accepted into the athletic training program. Got the athletic training program, into the athletic training program about a year and a half into the athletic training program. I found out I was pregnant.
Okay.
So pregnant in my 40s. I really could not follow the clinicals. So you follow the sports teams and stuff through the athletic major program. So I dropped in and really went and pursued then my exercise science degree from there. And so I have a minor in nutrition, and I also have 12 hours of my master's program too.
Okay, cool. And you said, where did you go to get them again?
Southeast.
Southeast, okay.
Yeah, Southeast is where I finished it.
Why did you choose your profession?
Well, like I said, I was going to athletic training, and I really wanted something in the medical field. I did not really want to go into nursing.
Yeah.
So that was really more of a pre-physical therapy or type of thing. So that's really what I wanted to pursue. So more wellness in the exercise science field.
Okay. All right. In the Powder Bluff area, would you say the job opportunities for simply an exercise science degree or exercise science major or anything in the related field would you say the job opportunities are increasing, or are they just kind of?
I think there are opportunities, but probably in this area, it's probably a little bit more restricted. If you're going to go through exercise science, having my own business, I would probably look at different options. I probably would have gone more to cardiac rehab because that's probably closer to what I was looking for to some degree. Definitely would go on and get a master's after this because I think that kind of just sets you up. I think you really have to determine which area you're going to go to. If you're going to go into wellness and personal training in that track, that's a totally different track than if you want to go into more maybe injury prevention in a or strength coach. So you have several different tracks, and I think you really have to pick your track, and maybe you do that with the master's program, but you actually do that with your internship. So be very selective with your internship and which way that you want to go.
You said you were interested in cardiac rehab.
Mm-hmm.
Would you say that that's more prevalent in this area, or you say it's just better opportunities?
I think that you would probably get a job where you get benefits. So just the opportunity as far as maybe advancement in the medical field, and then just a more stable position with, in a hospital or medical setting with cardiac rehab.
Okay.
So.
In the Poplar Bluff area, as far as, like I said before, simply having the exercise science bachelor or master degree, a starting salary for that would be at base salary. Can you give me an estimate that you can think
I
of?
would probably say you're probably between 20 and 25,000 for a base salary. Now, if you're going into rehab, you probably can get a little bit more with rehab, and then you're going to get the benefits and stuff that kind of comes with that employment too.
Okay. And you said this is your facility, correct?
This is my facility.
How long
yes.
did it take you to get this all up and going?
I've been here 3 years, so so I've been here 3 years, and I pretty much after my internship I started it. So
awesome.
the one thing I've cultivated some really good relationships with some PTs. Then that way I get some referrals for post physical therapy, you know what I'm saying? So we get some of those people that are coming in. I really geared my workout facility not as a gym, but really as a place where people could come because it's private, so they can come and exercise in private. So really geared toward that 80% of people that are not exercising.
Yeah.
So that's really where it's geared to. So it has a little bit different feel than what a gym or you know what I'm saying, a typical gym would be.
Okay, awesome. Cool. Would you say that having an exercise science or master's degree is a good base for going into a said related field, such as having your own practice or PT, PTA, something of
I think it's great because it's going to give you a lot of the foundations of what you want to do. So yeah.
What advice would you give to someone such as myself pursuing exercise science, a bachelor, master's, and hoping to go on into related fields?
I think the biggest advice was go out and get as much experience as you can, you know what I'm saying, in the different tracks that we were just talking about. In other words, go out and do some personal training at the local gym. Go out, if you want to see what cardiac rehab is like, go out and see if you can find somebody that's doing some cardiac rehab. Get into that setting so you know what that's like. If you're interested in the PT track, go out and look at what they're doing, you know, from a PT standpoint. I think that's the biggest thing. I know everybody has this dream about owning their own business and being their own boss, but early on that's very difficult. Long hours, not great pay in the beginning. So I think you really have to look at what you're really looking for in the long term. So if you're looking in the, into the medical field, and you want to maybe even go into, public health and those type of things, then you actually have to pick your track. But it's harder to do that without really knowing or having some observation or really working in that, experience in that. Even if it's just for 6 months, I think it really opens your eyes to what's there and talk to as many people as you can.
Oh, absolutely.
Okay.
That's all I have. I appreciate it very much.
Oh, you're welcome.
Yeah, that's it.
Yeah.
Now you have to have an RN.
You don't have to have you don't have to be an RN for the cardiac rehab, but you do have to get usually when they hire you, you have to have, I think, 600 hours. Some of the requirements might have changed. 600 hours of experience. So they have you go in and do, that's where you get it through your internship. You have to know a little bit about EKG, so you're looking at rhythms and stuff like that. And then you have an exercise physiology exam, so you're a registered exercise physiologist. So you're really getting much more into the medical side of it. So it just really depends on, you know what I'm saying, what you want to do with it.
Yeah.
But it's tough.
Oh yeah. Exercise physiology, that is what exactly? It's basically...
It's really how your body responds to exercise. So from a
Okay.
cellular standpoint.
Yeah.
So you're looking at, you know
So
what
it
I'm
has
saying,
a lot to do with...
yeah, what, do you get an endocrine response? You know what I'm saying? What happens to the lung? What happens to your lung volume? You know what I'm saying? What happens to your CO2, your O2? What, you know, what, everything from, you know, are you burning carbs? Are you burning fat during, you know what I'm saying? When you get into that,
Oh, yeah.
that's really from a cellular, that's where your A&P will come into.
Mhm.
So all that A&P stuff that you're learning about, I don't know if you've gone through A&P
I've
yet.
already had A&P 1 or 2 years.
Okay, so all that stuff that you learn, you're gonna learn from an exercise standpoint, what's going on in the body.
Okay.
So, and
Yeah.
that's probably coming up, probably next semester, I would imagine.
Yeah.
So I mean, so that's the much more the medical response. You even get into looking at the heart and, like I said, some of the rhythm stuff and stuff that's going on. And, you know, if you go on, then that's your master's. You know, if you, especially if you go into that thing, they have, at SEMO, they had a couple classes that were just dedicated to reading EKGs, advanced
Mhm.
stuff. So you're looking at rhythms, reading into EKGs. So when the guy that taught us had his degree in exercise science, and then he went on and he's a pacemaker. He sells pacemakers, so
Really?
he's a sales rep for pacemakers.
Yeah,
So you
okay.
have, you know what I'm saying,
Tons
there are
of
other
different-
options that
yeah.
sometimes that you don't think about, but
Yeah.
you just need that background for it then too. So there are some of those people that have gone and done those things too. So he comes in and he sells, he's the sales rep, but he comes in and does all the resetting and stuff like that when people need their pacemakers.
Yeah.
Sometimes they need them reset for different things, so anyway. So I think, like I said, the biggest thing is really get out and really experience, you know, what's out there, what's not, because it's different here
Yeah.
than if, you know, saying even down in Jonesboro, because Jonesboro's
Oh,
just
yeah.
so much bigger and than it is in the big cities and stuff, because your opportunities will be a little bit different there.
Okay, well, here's another question for you. I'm planning on doing an internship in Hot Springs, Colorado.
Okay,
Would you say that, because I'm wanting to work somewhere near Collar Bluff, Cape, Jonesboro, you know,
Okay.
somewhere in the surrounding area, not too far from home.
right.
Would you say that I should do an internship closer to home?
No,
Or-
not necessarily, because that'll give you an idea, and I don't know what kind of, what are you doing, what is your internship?
My internship is I'm going to be working. I'm not 100% exact sure
Right.
what I'm going to be doing
Mhm.
yet. I believe it's an outpatient, and I'm going around, and I'm going to be, of course, I'm going to be with some other people. I'm going to be assessing physical fitness on, I believe, the elderly
Okay.
population.
Okay,
But like I said, I'm not exactly sure what all that entails because I still have another year of school left until I start my internship.
okay.
So
No, I mean, I think getting out and seeing what other things, because sometimes you can bring any of those things that you learn out there, you know what I'm saying? Because you're going to be exposed to all of that here. So doing your internship away is good. The good thing is if you do your internship here with someone that you're familiar with, that you
Your
might want
name
to get a
out.
job
Yeah.
with, then it can get your name out too. So there's some pros and cons to that. But I mean, if you have a chance to go out and kind of look at other, you know, avenues, then I would definitely, you know what I'm saying, because you can, I would definitely take advantage. Do you know which direction you're kind of leaning to?
I thought about not cardiovascular, exercise physiology,
Right,
and I realized that I got a little more intricate into cellular stuff and stuff like that. I didn't know. A bunch of my friends are wanting to do strictly cardiovascular physiology,
okay,
and I thought about that. I'm not. I think I'm more leaning away towards that right now.
Okay.
I've also thought about PT, of course, PTA, massage therapist.
Right.
I've also thought of that.
yeah, and there's a couple of the things, and there's a couple websites that I follow that has some, you know, kind of have some really reputable people on there. And it, you know what I'm saying, you can even specialize, even if you're gonna go into strength and stuff, if you're, you know, you can specialize a little bit with that. But one of the things they do say that if you go on to get another degree or another thing, that you might want to think about doing something that complements what you're doing, not necessarily that's the
Yeah,
same.
absolutely.
So you're thinking about even massage therapy, where then that way you have the benefits of if you are in this realm, or if you even go through, you know what I'm saying, or working there, you have the benefits that you can actually touch or massage or
Yeah.
whatever, you know what I'm saying, if somebody has an, you know, injury. That's the one thing that athletic training has kind of helped me, just having some of that background, even though I didn't have spine, I had upper body and lower body, was I can really tell if somebody's really injured or not.
Yeah.
You know, not all the time, but the majority of the time, like, you know, we may want to get you out of here, because 90%, well, of my clients that are coming in, a lot of them have had, so some of them are post-rehab, they've had injuries. They've had back injuries. You know, I had status post ACLs, some ACLs that aren't repaired because they were, you know, a while back. Neck injuries, so people that have had neck fusions, ton of shoulder stuff, ton of shoulder issue. So having that injury, you know, kind of background and kind of knowing those type of things, which you're not taught in the exercise science, you know, side of it, you'll get overwhelmed really quickly, because that stuff just comes in, because you're not always seeing 20-somethings that are coming in. If you, you know, you need to know how to deal with, and that may be the thing with, if you're assessing older people and they'll tell them you can't do this, or I have this shoulder injury, you know, you have to figure out what can you do with that person if they want to become, if they want to become active and stuff, and what can you do and do it safely. So that actually was kind of a plus for me, because that kind of gave me that background. So it's, you know what I'm saying, it's really difficult to say, you know, I wish I could tell you, but definitely I think picking your track,
Kind of having more set out.
Having more set out than just kind of this broad exercise science, and kind of thinking, you know, I want to go this way, or I want to go this way. And sometimes, because then you go and you observe somebody for 3 or 4 months and you're like,
I like it,
Kind of like, you know, PT, people have this idea of what PT is. Well, the majority of people in PT, you know what I'm saying, probably Chad would tell you 60%, and even Ryan would tell you that 60% of people are 50 and over, and a lot of them are 60 and over, you know what I'm saying, and you're dealing chronically with backs and stuff like that. If you don't want to deal with that, then, you know, physical therapy may not be the way for you to go. So, you know what I'm saying, so kind of seeing some of that background will kind of help. Now, if you're in a bigger setting outside of Poplar Bluff, then those opportunities might be different for you, and So, so hopefully that helps, and not too much.
Would you say that for here that you see a lot of sports-related injuries, or is it more?
I see more just daily type things, like somebody will come in, like I said, a couple of the people that have ACLs, I mean, they had ACLs when they were in their mid-20s. So it wasn't, you know, and the girls, they step off the curb wrong, or they did, you know what I'm saying, or they were just fooling around, and they did that. Actually, one of the nurses out at Brad's, or out at the surgery center, she was goofing off. She was down at CrossFit, and she was doing a tumbling routine, because you probably know her, but she was doing a tumbling routine, something that she'd done when she was a cheerleader, but that was 6 years back, and she popped her, so you know Mallory then.
I think I do,
and you know, she popped her Achilles, so, you know what I'm saying, so it's like that. It's not necessarily people that are sport type things. It's one of those things, they go out, they do something, all of a sudden, and they wind up, and it just happens. And so, and if you're in that setting, at some point, you'll see somebody will do something, and boom, you know what I'm saying, they'll get injured and stuff too. So, and I have other people where, one of my clients, she just woke up one day and she says she had arm pain, you know, saying terrible arm pain. The only way she could get any relief was like this. Well, she had herniated a disc in her neck, you know, that was compressing C4, C5, you know, but she just woke up like that. And she came into me 2 years after the injury, heavier, wanting to lose weight, obviously, and that's when the majority of this is. And so that's what I said, this is a lot of weight loss. So if you don't want to deal with weight loss, then, you know, that's the other thing. You know, so what can we do with her? She's had a neck fusion done. So there's certain things that she can definitely do, but certain things we have to start off real slow. But she's the one that she's had an ACL, she's had a neck injury, she's had, she has chronic SI dysfunction-ish stuff with her, you know, in her SI joint, and she's had a shoulder, she's had, so you know what I'm saying, and she's 45, so it's not like she's 85, so you just have to figure out what it is. So that's the kind of stuff that I see pretty much on a daily basis. So, you know, and most of my clients are 40 and over. So, but hopefully I'm talking you out of it.
No, I greatly appreciate it. I really do.
And like I said, and that way, if you talk to Tony could probably give you a little bit better idea too. And I don't know if he got his undergrad at ASU too, but I know he definitely got his master's at ASU, but he may be able to give you, and I don't know why he's here. I don't know if he grew up here, you know, or what, but he might be able to even give you a different insight, because he's doing the acceleration, like I said, the acceleration
Yeah,
program and
I've
stuff.
done it before, but I don't. Solomon Woodchurch trained me whenever I was doing the acceleration program.
Yeah. So I think Tony's still doing it. That's last I heard, he was still doing that. But he had a really nice write up in the paper about 6 or 8 months ago where he was working with Parkinson's patients.
Okay.
So he's kind of got a whole spectrum of people that he's kind of working with and training too. So definitely I will talk to him.
Okay, absolutely.
All right.
I
Well, great.
appreciate it.
Hopefully, like I said,
Yeah,
hopefully I
definitely.
give you some useful